Now, you developed something called the Seeker's Method. I wanted to hear about how you came about that from going from neural therapy into the Seeker's Method and, more of this blockage-based care.
Well, in my practice, I inject patients all day. And I work in my practice in Canada. I spent 20 years working in the equivalent of a Medicare system.
Mhm.
And most of my patients were on very limited incomes. And so for that group, functional medicine testing, supplements, IV infusions, that's out of the question.
Right.
So I had to start learning to use more simple, basic tools. So I started using acupuncture needles, targeting the ear, and I started using my hands. I had been trained in auricular medicine. I had used EAV technology, and I had also learned applied kinesiology. And I don't think anyone ever connected those dots before, but it occurred to me that those three modalities are trying to elicit the same thing, right? So when a strong muscle goes weak, it's because you've triggered a stress response. When you feel a change in the pulse over a point on the ear, that's because you've triggered a stress response. And when something during an EAV test changes skin conductivity, that's because you've elicited a stress response. And it became evident to me that as I was working with my hands and becoming comfortable feeling tissue, that interference fields are actually palpable using light touch to identify areas that react
Mhm.
with a stress response. And that stress response is just an area that feels different. With practice, you come to recognize that there's like a relationship between the healer and the patient, and that when the patient has a stress response, you also have a stress response. And that's a beautiful part of the healing process. But when you recognize that these spots are palpable, then you start to see that you can connect one interference field to another interference field, and you can actually create a line. And you start to realize that the stress that creates the pain that pulls people out of alignment, that distorts anatomy in subtle ways that manifest as chronic disease, that these actually represent long chunks of flesh that are in a state of tension because of the 2 points connecting them. And you can learn to use movement and breath to create tension when they inhale, asking them to contract that myofascial chain, and then exhale and release. And I'm working to create more video content so that patients can learn to feel where they have interference fields, and they can learn to stretch and release as a self-care technique. So whether they're using yoga or Tai Chi, they can adapt that routine to do some stretching that targets a specific line that's stuck in them.
Mm.
And any rehabilitation provider can do the same with their hands. So neural therapy moves beyond being a single injection technique to being a neural therapy approach where, regardless of your modality, whether you're using your hands or acupuncture needles or laser or injections, targeting those lesions is a neural therapy approach that is what I call blockage-based care.
Yeah. And that's the thing. I mean, you could do it with needles, you can do it with light, you could even do it with frequencies. There's different ways, electrostimulation, all sorts. What we're talking about is this neurotherapy approach with the injection of a substance to do that as well. But there's many ways about it, and I think the way you're going about it in a synergistic way of taking what was, before and all these beautiful modalities and starting to put them together, you're getting this beautiful orchestra together, right? And that's what medicine should be. As much as there's specializations, and I think we're becoming niche specialized into further, things where you're just doing one singular little thing. Medicine, especially the whole concept of integrative medicine, is bringing together and seeing that. And in that, case, I have to ask you because there seems to be this, integrative alternative medicine side and conventional medicine side, and the two just, butt heads. And they say, you're wrong. You're wrong. Do it this way. You're woo woo, whatever. Do you find in your concept, especially coming from a conventional background, that the two can work together and should? It's just how they need to go about it.
This is absolutely essential.
Yeah.
And I think what's missing is just a common language.
Yes.
So the notion that meridians exist is the first sticking point for conventional medicine.
Hmm.
And the key insight that opens that door and allows conventional and holistic practitioners to talk to each other is if we recognize that collagen, the stuff that fascia is made of, is piezoelectric. It's a crystalline polymer fiber. And what that means is that all of the electricity that's coursing through your nervous system is making collagen buzz. And that vibration is eminently palpable with our fingers. And the path of vibration flowing through myofascial chains is the flow of qi.
Mm.
It's the path of least resistance that vibrations travel through these fluid-filled channels. And that's why when European anatomists dissected the body a few hundred years ago and they couldn't find meridians, they assumed that Chinese medicine is bunk. Because you can't touch them and feel them the way you can feel arteries and veins and nerves. But if we have a common language that helps us explain energy in terms of vibration and electricity and palpable, real, concrete engineering stuff, then there's no disagreement. There's no basis for rejecting something. The thing that's challenging is that, we are working in an era of evidence-based medicine where, of course, evidence should guide our decisions. But, I think that many conventionally trained doctors don't properly use evidence-based medicine because in their mind, it's like a binary thing. Something is proven and it's in the guidelines and I should do it, or it's not proven and I shouldn't do it. Whereas, the rational approach is to start with the things that are proven, the things that have the most efficacy, safety, cost, and convenience and patient preference going for them, and then move down the list until you get to the esoteric.
Right.
Again, focusing on things that are safer, less invasive, but doing what works. And I think if we can use the language of what I call rational prescribing, which means, you look at the options for solving a problem. You define what's the problem, what is it that I want to see improve, okay? What are the things that I could do to make that better? Let's talk about the options and decide what we're going to try together. And then let's try it. Let's set up a structured intervention trial. If it's a gluten-free diet for 3 months, or magnesium for 2 weeks, or this practitioner or that modality for 6 sessions. Let's see what works and keep using what works. And if something doesn't work, let's move on to the next thing. And so that structured, rational prescribing approach makes it easier for someone who's sick and lost and has tried everything to kind of chart a course for their healing and work with a provider over a year to say, we're going to try several things. This is not like a once and done solution. And I think with that approach, where you take a patient-centered, relationship-based approach, where the doctor's job is not to do what's in the guidelines. The doctor's job is to get the patient better. I
I
think
think
that's the
that
way forward.
I agree with you, and I think there is an over-reliance and hyper-focus on evidence-based and what that means. And I feel a lot of times just the tools and what we're looking at are a little different, right? If you're trying to find meridians in a panel, blood panel, you're not going to locate that there. But if you look into other devices that aren't as common in conventional medicine, but are quite science-based, you could start to rationalize that. And that's, a whole other field outside of medicine. Medicine seems to be reliant still on Newtonian principles that are very old in some ways and not on new principles that are actually validating so much of what we know and the ancient civilizations knew that are carried on, advanced in new technologies and discoveries themselves, like neural therapy, and therefore should be evidence-based but aren't. And then there's the other side of the coin, right? Like you're saying, what about experience-based medicine? What about what the actual patient sees, feels, and gets out of their experience in trying these things? And I think from that standpoint, you're going to find a lot of happy patients that have experienced better resolution than what the evidence showed them they should be doing. So that's where it starts to, open it up. And I do completely agree that if everyone came to the table with an openness, conventional surgeons, spiritual leaders, everyone that can help that patient and just place the emphasis on what can we do here together? Is there a way we could start on a drug but taper off, let the body get to some level of homeostasis, then go in with a natural, then go in with neural therapy, IVs, all this stuff, and address the root cause while still saying we acknowledge your symptoms and want to give you relief? I don't know, it just makes sense to me a little bit more than this way or no way, this way or no, and people suffering in the meantime.